If you've just been diagnosed with breast cancer, your world stops spinning. Your surgeon, just as I used to, will be bombarding you with information about surgical treatment options, asking you to make a decision. How do you know what to do? What if you want to have something different? Or you simply need more time to think? I'm Dr. Liz O'Riordan, the breast surgeon with breast cancer and the author of the Complete Guide to Breast Cancer. I do the research so you don't have to. In this video, I'm going to explain how your surgeon works out what treatment to offer you. I'm going to tell you the questions you need to ask to help you make the right decision for you. And as a bonus at the end, I'll tell you why sometimes you might not get the operation you want. How does your surgeon decide what operation to offer you? Well, before you get your results in a breast clinic, a decision is made about the best treatment for you by a team of surgeons, oncologists, radiologists, pathologists, and breast care nurses. They review all of your results and everything they know about your life and your medical history, and they make a decision about the breast and axillary node surgery you need to treat your cancer. And this is based on the size of your breasts and the size of your tumour. If you need to have chemotherapy first, the team will meet again when you finish treatment to go through the same process, and that is based on how your cancer responded to chemotherapy. As a rule of thumb, a breast surgeon can remove up to 1/5 of your breast together with the cancer and reshape it to give you a good cosmetic result. If they need to remove more than 1/5 of your breast to safely remove the cancer, they'll need to do one of two things. The first is consider oncoplastic techniques to fill the gap or reshape the breast, such as a breast reduction or a mini flap, or they'll need to do a mastectomy with the option of a reconstruction either at the same time or at a later date. Can a surgeon change their mind? Well, yes, they can, especially if they haven't met you before, such as women who were diagnosed through the breast screening programme. Your surgeon may need to examine you to properly assess your breasts before surgery, as there are 3 things that they need to take into account before they make a final decision about what to offer you. 1 is how dense your breasts are. If your breasts are dense or firm, it means it's easier to move your breast tissue around underneath the skin to fill the gap left behind by the cancer. If your breasts are very soft and fatty, it means it's much harder to reshape your breasts once the cancer has been removed, and that may change what your surgeon does. Number 2, are your breasts the same size and shape? Most breasts aren't. They're sisters, not twins. And your surgeon and you need to accept how you look before the cancer so they can try their best to match it after they operate. They can't promise perfection. The third and probably most important thing is the quality of your skin. If your skin is very thin or damaged from years of sunbathing or smoking, it does affect the surgery that your surgeon can offer you. What happens if you want something different? Although most women and men do go ahead with the operation their surgeon offers, it is your choice and you can ask to have something different. You can also ask to have an extra couple of weeks to think about it, to maybe talk to someone who's had the same operation and get more information. Breast cancer isn't a medical emergency, and for most of you, it's fine to take another week or 2 to come to a decision that you're happy with and that you don't feel rushed into. By taking a bit more time, your surgeon might be able to come up with an alternative solution that might make you feel happy. The one exception is inflammatory breast cancer, when you will be quickly started on chemotherapy, followed by a mastectomy afterwards. Can you have a mastectomy instead of a lumpectomy? Well, most women and some men have an operation called a wide local excision or a lumpectomy. This can be done as a simple procedure or as part of something more complicated, like a breast reduction or a mini flap, where chest wall tissue is moved around to fill the gap left behind by your cancer. If you have invasive cancer, this is always followed by radiotherapy afterwards to reduce the risk of a recurrence in the future. And some people with non-invasive cancer, also called DCIS, may also need radiotherapy. However, if you don't want to have radiotherapy for whatever reason, you can ask to have a mastectomy instead. Now, your surgeon, as I used to, might think you're a bit strange because we like to preserve as many breasts as possible, but it is your choice. Radiotherapy can mean up to 3 weeks of travelling back and forth to the hospital with all the side effects of the treatment as well. However, a simple mastectomy without a reconstruction can be done as a day case, so no overnight stay in hospital, and no further hospital treatment is needed. What happens if you want an operation that your surgeon can't do? Although most surgeons these days are trained to do the more technical operations to recreate and reshape your breast, called oncoplastic techniques, there will be some who can't offer you what you want. You might need to decide whether to stick with your surgeon and have a simpler operation or be referred to someone else. And some reconstruction operations, where your fat and muscle are moved into the breast skin, need plastic surgeons. And if your hospital doesn't have a plastic surgery department, like my old hospital, you will have to travel to have your surgery at another site. Before I tell you the 10 questions you need to ask yourself before making a decision, if you like what you've seen so far, remember to subscribe so you don't miss next week's video. So here are the top 10 questions to ask yourself before making a decision about breast cancer surgery. Number 1, what is your priority? The most important factor should be getting your cancer treated properly. Although how your breast looks afterwards is important, your life should come before your looks. Number 2, do you know your breasts? Your breasts are sisters, not twins, as I said. One breast is always a bit bigger or a bit droopier than the other. There's no polite way of describing a breast that is headed south for winter, but the technical term is ptosis. Your nipples may even be at different heights or different sizes. Your surgeon will try to match what you already have, but they can never promise perfection. Number 3, what do your breasts mean to you? Your breasts can define your identity as a woman. You may love them or hate them, wish for bigger or smaller ones, flaunt them or hide them away. They may be incredibly important sexually, or you may have very little feeling about them and you just can't see what all the fuss is about. You may have loved your breasts as a young woman, but now you've raised a family, they're not that important to you. It's also hard to think rationally about them when you're dealing with the fact that one has breast cancer. But knowing how important your breasts are to you and your identity can help you decide what to do. Number 4, do you want to look good in your clothes, in a bra, or naked? You may opt for a quick, simple operation and be happy to wear a small prosthesis in your bra to make you look symmetrical in clothes, or you may choose a longer, more technical operation so you look symmetrical when you're naked. Number 5, have you seen post-op photographs? Ask your surgeon to show you before and after medical photographs of patients who have had the operation that you're considering. If a surgeon shows you a good result and you think it's great, then you're both on the right track. But if a surgeon shows you a good result and you think it's awful, you may need to lower your expectations. It's not what you see on the TV with the plastic surgery programs. Number 6, do you mind where the scar is? If your breast appearance is important to you and you're having a lumpectomy, it's normally possible for your surgeon to hide the scar around your nipple or at the edges of the breast. But putting the scar around the nipple areola complex can affect your nipple sensation, and it might not be sexually active in the future. You may lose all sexual feeling. If you're not bothered, we can just cut down directly over the cancer and still leave you with a good result. Now, breast skin scars can occasionally widen and thicken, called hypertrophic scars, and this is more common after a breast reduction. And African women are more prone to developing bulky keloid scars, which can extend onto the rest of the breast and be very difficult to treat. So if you have ever developed a thickened scar in the past, make sure you let your surgeon know. Number 7, do you want to be able to breastfeed in the future? If you're planning on having children in the future, and it is safe to get pregnant after breast cancer, and if breastfeeding is important to you, you need to factor this in. Because you can't breastfeed after a mastectomy because the breast tissue has been removed. Most women can still breastfeed after a lumpectomy unless you've had a breast reduction. Number 8, are you willing to travel to get what you want? If your surgeon doesn't know how to do the operation you want, or you don't click with them, or you need to go to a different centre where there is a plastic surgeon, Do you have the time to travel to a different hospital for appointments, surgery, and follow-up visits? Are there people who can support you and your family whilst you're travelling back and forth and you're staying away from home? It can be exhausting travelling long distances after surgery, especially if you end up with a wound complication afterwards. Number 9, how quickly do you want to get your life back? Now, this is really important. If you want to quickly return to work, childcare or sport as quickly as possible, you might opt for a simpler operation with a shorter recovery period in order to achieve this. The surgeons initially make decisions based solely on your tumour size and breast shape. We want to give you a good cosmetic result as well as removing the cancer, and this may require a lengthy operation with a long recovery period. However, the surgeon isn't the one who has to live with the side effects of the surgery, so you need to speak up and let them know what is important to you. Never feel bad about asking for something simpler than what the surgeon is offering. Number 10, what will your breast look like in several years' time? The shape of your operated breast will probably change as the years go by. Radiotherapy fixes a breast in time and place. This means as your natural breast gets bigger or smaller as you gain or lose weight, or starts to droop as you get older, the cancer side won't change to match it. You may also develop dents in the breast where the cancer was. There are surgical options you can have to help, such as fat filling with lipotransfer or removing dog ears, and you can talk to your surgeon about them. Now for the bonus section, why you might not get the result you want. Now, as I said, most surgeons will do everything they can to help you get a good cosmetic result, but sometimes they need to compromise on the appearance of your breast so they can treat the cancer properly. And the most important factor when deciding what operation to do is the quality of your skin. Now, I said this earlier. If you've been smoking or vaping for several years, this narrows the blood vessels in your body, and that means that the skin of your breast doesn't get as much blood as a person who doesn't smoke. If you need to have a mastectomy or a breast reduction, without a healthy breast skin envelope, a restriction won't survive, and a reduction might not heal. And that's why the vast majority of surgeons won't even consider doing a breast reconstruction in someone who smokes. If you have severe medical problems that affect your heart and lungs, such as very high blood pressure or emphysema, the risks from a longer general anaesthetic are much higher, and your surgeon may guide you away from a complex operation like a breast reduction towards a quicker, simpler operation like a lumpectomy or a mastectomy. If your breasts are larger than a D or E cup, it is very hard to recreate a natural matching shape on the other side using an implant. And if you are very slim, you might not have enough fat on your tummy, bottom or thigh to recreate a breast shape. If you're an athlete, you might not want to use muscle from your leg or your back to reconstruct your breast. This could impact your sporting life. That's why you may need to choose to have an implant reconstruction or just simply go flat if getting active and back to sport is important to you. I hope you found this useful. You can put your questions in the comments and I'll get back to you this week. Remember to subscribe so you don't miss next week's video. I'm Dr. Liz O'Riordan and thanks for watching my channel.